a very wonderful woman, and it's really my privilege and my honor. And the reason I say this is because this woman has been in my life since I was this tall. She is one of my mom's best friends. My mom couldn't be here. My mom is getting older. She's suffering dementia, and it's, she's the love of my life. She's been the pillar of my life and career, and I love her so much. My sister Maria and I take care of my mom. And we're so blessed that she was such a good sister. And when I say sister, it's not because she had 4 sisters of her own, but because she had a whole community of sisters. My mom was a social worker, and she was all about embracing that sisterhood, that girlfriend that helps each other, that counts on each other, that's always there for each other. So this lady that I'm about to introduce to you is one of my mom's best friends, and she actually flew from Chicago. As you know, Maria and I are from Chicago. She actually flew from Chicago last night to be here. She has a PhD in psychology. She is a lawyer. She's been practicing with women and families for more than 30 years, and she knows everything about ups and downs of hormones and ups and downs of emotions and mood swings. So I'd like to I do a lot of interviewing, so I'm sorry. I'd like to introduce to you right now Dr. Doris Ayala, whom I love so much.
Buenas tardes. Good afternoon. Thank you for that wonderful introduction. I would like to definitely thank Merci and Mary and Elaine and Eileen, who's going to help me out here, and all you wonderful women who are, were challenged by come here today to learn more about menopause. So I want to thank you also for participating in this wonderful seminar, and I'm hoping that my only complaint is that they've given me very little time, and I'd like to get more time next year. So definitely. I'd like us to start with the thought of, they've talked about physical fitness, hormones, estrogen, progesterone, testosterone. I'd like us to think about mental fitness in terms of how we look at menopause, how we perceive it, and what our attitude is. And basically what I'm going to do is I have a presentation here. I'll probably not read everything. You can have access to the presentation if you want it. I know they're sending something out, a sheet of paper out. If you want a copy of it, by all means, you can have it. There's not a whole lot of new information that I'm going to share with you, but it's important in the sense that for me, there's a long list of things, and it's important for me at my age, 61, to feel a little organized here so that I can go back and forth, and I'll be talking about my own experiences and also some of my clients' experiences. And when we talk about mental fitness, we look at it as it's so important to move on and to do everything that we want to do. We look at, in terms of the physical fitness, we need to be mentally fit to even think about doing the 20 minutes of exercise every day. We need to think about how we're going to go through these symptoms. So I'd like to begin with how you view it as a developmental passage. We all go through developmental passages. This is just another one, okay? It's a new phase of life, a new chapter with a new outlook in life. So what you need to do is think of it in a positive way. We usually look at our symptoms as something that, it's overwhelming, and, how are we going to move on, et cetera, et cetera. If we look at it with a more positive outlook, we're going to do really well. I'm still menopausal. I'm 61 going on 62, and I still suffer the hot flashes, and I still, feel stressed out when I feel these symptoms. But I think of it in a positive way. And it's going to take a few seconds, maybe a couple of minutes. It'll go away. I'm going to move on, take my glass of water, do what I have to do. So what are the psychological difficulties shaped by social and cultural environment? I was talking to a few of the women, and I'm telling them that not all women go through this process. I mean, there are some women from different countries who don't even feel the symptoms that many of us feel here. We're talking about how there is a fear of becoming older. And there's a widespread view of menopausal women as ailing and diseased. Menopause is not a disease, okay? So we move on. We perceive the loss of youth, and when we look at ourselves in the mirror and we say, oh my gosh, I'm getting the wrinkles, I'm graying, my hair is graying, and how we have to maintain a youthful look, otherwise, we're different. And so that's something that we look at. The pressure of remaining young. A lot of women undergo plastic surgery, they spend lots and lots of money on cosmetics, on anything that will make us look younger. Again, that's the pressure that we're under to feel and look young. So keep in mind, even if we're, overweight or if we're slim, we're still gonna sometimes feel bad about who we are and what we do and how we do things. And that's where mental fitness comes in. We have to start thinking about how we do things in such a way that we're going to overcome the stressors, the overwhelming fears that oftentimes this society imposes on all women. So we're going to get respect, we're going to get happiness and love that's still going to be attainable. And look at getting older as an inevitable part of life and welcoming it, okay? So again, menopause is not a disease, it's an abrupt hormonal change in the brain. And we want to view these as discomforts and difficulties that are transient in nature, okay? The symptoms of mental and behavioral changes, irritability, tearfulness, and I come across a lot of women who just come in and say, well, I'm just crying. I don't know why I'm crying. That's one of the symptoms. The excessive worrying, anxiety, diminished energy, problems in concentrating, feelings of low self-esteem, poor self-image. If we gain the weight, we look at ourselves and all of a sudden, we're looking and saying, we shouldn't look like this. We become depressed. And then there is some loss of memory, which is a neurological issue. The contributing factors that lead to psychiatric conditions. Always remember, too, that many of the factors that influence some of these symptoms have to do with maybe our own history, genetic, or how we've been raised, et cetera. And there could be an existing clinical depression. A lot of individuals have suffered depression from an early age, and this just exacerbates that. It's not a situational depression for many women. There's an unusual amount of anxiety. Some anxiety attacks or panic attacks come into play. Some women get really obsessive and compulsive about things. They have to have things just exactly the way it is, this here. And so that tends to play into how we see things and do things, especially in our job settings. Bipolar moods, one minute being depressed and the next being, manicky and wanting to go shopping and buying everything you see, et cetera. It's just one of those conditions. Severe memory loss. There are some women who begin to experience memory losses. And I was making a comment earlier today that sometimes when I forget something, and I can forget something that's, been on my mind, et cetera, for 1 minute I'll forget it. And the other day my cousin says, well, you're into one of your senior moments. Now, I'm not even sure where that came from, but that's the term that's being used right now. When you forget something and you can't remember it right offhand, you're into one of your senior moments. There could be some erratic behavior, paranoia, and again, a lot of this can be caused by the challenging stressors in life, the divorce, a job loss, things like that that come into play every day in our lives. We have families, we have issues with family members, we have issues with people that we work with. So all these things can exacerbate the conditions that we experience, the symptoms we experience during menopause. So how do we cope? Adapting healthy strategies can help you achieve a happier, healthier future. Again, be in tune with your body. Know when something is wrong. Think about what may be wrong and how you can deal with that. Assess your moods and physical changes. There will be mood swings like I mentioned before, and the other presenters mentioned, and there'll be body changes. What do we do about these things? Embrace change. We're all going to change. We've all been changing since we were born. And if you take a positive attitude towards this, you'll be less inclined to feel the series of symptoms that come with menopause. Take a proactive approach to medical intervention. Sometimes women will need to take some type of medication. For example, when I started my menopausal symptoms and I started experiencing I became so irritable that nobody could tolerate me. So, my husband, who's a psychiatrist, said, why don't you just take this small dose of Zoloft? And so I said, sure, why not? And actually, I took it for 3 to 4 months, and it did wonders. And then after that, I didn't have to take it, but it stabilized my mood. And when I usually talk to clients and they say, no, I don't want to take any medication, I talk about my own experience and also about the supplements that I've also taken throughout the years so that it could help me with the symptoms. For severe symptoms or to cope with all the stressors that you feel, talking to someone in the mental health field is often helpful. So one of the things that you can do is look for someone. Talking to family members and friends is really good and helpful. Sometimes they can give you good advice, sometimes they don't. So look for someone that you can see, a psychologist. You can also see a psychiatrist, a social worker, a licensed clinical social worker, a counselor. People in these professions will help you look at things and also identify some of the factors that may be influencing the depression that we often feel when we start menopause. Exercise regularly. I often see clients who are coming in and they say, well, I started I'm into menopause, what should I do? I cry, I get depressed, et cetera, et cetera. I say start exercising. Use that time to start thinking about how you can change your metabolism, maybe lose the weight, et cetera. But I don't want to do it. I'm not motivated to do it. And then when we talk about physical fitness, sometimes we're not often motivated to do it. So what we do is, I usually tell my clients, I say, take 5 minutes. Just do 5 minutes. Walk for 5 minutes. And it's not just the women, but the men also. And after a series of sessions, when they feel the support and the idea that they can actually do it, because part of therapy is to help motivate individuals into making the necessary changes. And so for example, a client the other day, she came in and she'd weighing 150 pounds overweight, and I said, well, start with 5 minutes, and 3 weeks later, she was doing 15 minutes, and now she's doing 20 minutes, and she started a program in one of the gyms. So it's just a matter of working through and finding out what those triggers are, what the factors that make people, go through the depression or even the, bipolar illness. Ensure regular mental stimulation. This is good for memory. You put puzzles, picture puzzles together. Not too long ago, I put a puzzle together in a few weeks, 2,000-piece puzzle. and I was just bent on doing it, and your memory gets better. Also, you can play a musical instrument, get into art, do something that's going to help stimulate your mind. It also reduces the symptoms of poor concentration and, of course, the memory loss. Engage in healthy social activities to improve mental function. Think about family reunions, going out with friends, but while doing that, also think about reducing the level of alcohol that you drink, that may drink, whether it's wine, beer, whatever it is. Since alcohol can have, and often has, a negative effect on memory, as well as on depression and other psychological disorders. I often see clients who come in and say, well, I have to have my shot every night, or I have to go out, and when I go out, I just want to forget that I'm overweight or that, I'm going through this series of problems, so I just start drinking. And, that's one of the reasons why their depression will also continue to affect them. Learn some relaxation or stress reduction techniques or strategies. Breathing techniques, that's a number one. Breathe in, you hold it a second, and then you breathe out. And you can do this 3 and 4 and 5 times, and you will notice that as the oxygen gets to your brain cells and your lungs and all your cells, you will begin to relax. Your anxiety goes down. And then you will find that oftentimes the symptoms go away. So basic to everything is breathing in and out. Even when you're sitting down or you feel that you're not focusing on something, all you have to do is breathe in and out. And that's one of the things that most people will not see you doing, so that you can feel comfortable about doing it. Hypnosis. Short techniques can help reduce all kinds of symptoms and negative thoughts. I'm also a hypnotherapist. I work with clients in teaching them self-hypnosis. Hypnosis can be a very expensive form of treatment, and what I do is I help them through the process of 1, 2, 3, 4 sessions, tape their sessions, and have them take them home and learn to apply the hypnotic techniques on their own. So that works really well. Anybody ever tried hypnosis here? You got one there, too? It works? Mm-hmm. I was also making mention that I joined Mary and Elaine on a marathon, and I had to use, it was 14 miles, and I had to use, it was a couple of years ago, hypnotic technique to actually make it to the end of the marathon, because by the 10th mile, I thought I wasn't going to make it. And I didn't want to go back in one of those carts back and say, no, I gave up, no, I didn't do it. I used a hypnotic technique to help me, and I was actually passing younger women along the way and made it to the finish line. So hypnosis really works. You just have to find somebody who is willing or is able to to take you through these particular problems that arise, and that the person helps you to learn how to use self-hypnotic techniques, okay? That's really important. Create balance. When dividing time between work obligations and caring for family, remember to take care of your own needs. Women have, for a long, long time, we always think of always helping others, our children, our family members, our colleagues. We rarely think about ourselves and thinking about what we need to do to help ourselves feel better, get better. There used to be a time when they used to call women that we had the superwoman syndrome, where we had to do everything. It's really important to think about ourselves. What can we do within at least half an hour of our time to help ourselves, to do better in life, to do better for ourselves? One of the things that I also present on is Practitioner Heal Thyself. I always talk to other practitioners about feeling good about who we are, what we do, and de-stressing. We see a lot of clients who have a lot of mental health issues, and this stresses us out too. So we need to feel good and be well enough to treat a lot of other people, and that's really important. We have to think about ourselves, we have to take time for ourselves, and we will feel much better and actually create a balance in our lives. So keep a balance between self, family, friends, and this allows women to meet new challenges and maintain self-confidence. Not only self-confidence, but also self-esteem and a good self-image. Women who have previously been diagnosed with depression are vulnerable to recurrent depression during peri and postmenopause. Are we on the right one? Evaluate levels of depression. Okay, that's after. That's okay. Women suffering from depression report symptoms of prolonged tiredness, loss of interest in normal activities, weight loss, weight gain, sadness, or irritability. And the treatments range from herbal remedies, and this is where some of the women in different countries also don't experience these symptoms because they've been using herbs most of their lives. And so that reduces the level of distress that menopause may cause some women. And prescription medication or talk therapy. Again, looking for mental health practitioners who can help you to identify the factors, the triggers in this time of stress and anxiety. Begin to assess your anxiety level. Physical and psychological changes as well as other midlife stressors can result in increased anxiety. A lot of women experience a lot of anxiety, and what I start telling women is to, again, breathe in and out. It does wonders. You will notice how the level of anxiety reduces to a point where you don't feel the stress, the overwhelming symptoms that come, the flashes, the hot flashes, the feeling tired, etc. The frequent episodes of anxiety may be a warning sign of a panic disorder. Panic attack symptoms include the shortness of breath, chest pain, dizziness, heart palpitations, or feeling of going crazy. I think you've heard that also in the song where people usually say, well, you're just crazy. Or feeling out of control. Sometimes the unsettling feelings that precede a hot flash can mimic or trigger such an attack. So think about that. There are a lot of women out there who are suffering panic attacks. They're afraid to go outside. They're afraid to be with people for fear of experiencing those panic attacks. And they're not nice. I mean, I personally haven't experienced them, but I've seen people experience them. And they look like they're a little psychotic after a while because they just lose it. You know, they can start crying, and then you don't know what to do with people like that. So if you've ever experienced that or have had somebody experience that, you begin to say, what am I going to do? How am I going to handle this? And think about what ways you can do that. So again, treatment includes the stress reduction techniques, counseling or psychotherapy, and prescription drugs. Mind your memory. Again, think about the kinds of things that you could do physically, socially, and mentally, which actively prevent memory loss. We're on the right track. Okay? Again, playing an instrument, crossword puzzles, all kinds of games nowadays that help people maintain that balance and also feel less stress. Don't try to diagnose or treat yourself. A lot of women, or men too, they'll go out there and they'll start looking at the internet to see what they could do and what kinds of medications. You know, there's a large group of people who will actually look for medication online and buy medication online without seeing a psychiatrist or a physician. That can be very dangerous. So think about that. Don't feel bad about going out there and finding somebody who can identify and diagnose what the problem may be. By evaluating symptoms as well as personal and family history, the appropriate health professions can provide recommendations and options for coping better. Remember, medication for depression can be most effective when used in combination with counseling or psychotherapy. Again, hypnosis can reduce the symptoms of menopause. So part of what I'm saying here too is let's change our societal views about menopause. And it's interesting how, we had the skit about, how they were feeling, et cetera, and how women go out there. There was a fear at one time of talking about menopause, about talking about the hot flashes, and thinking that people didn't understand, et cetera. So be a part of society that honors this phase of life. It's a developmental phase. When we look at adolescents, we talk about how their hormones are all changing and how, their behavior changes. Well, this is basically the same thing. We're going through another phase in life. We look at it with a positive attitude. We think about it as something in terms of it's universal. Every woman will go through menopause, and it's just a matter of what we can do to better cope with those symptoms and how we can move on in life without feeling so overwhelmed and out of control. Any questions? Questions? Yes.
Things that we can do at home for specifically
Mm-hmm.
things that we can do at home, not really having to see a specialist about mood swings because it's something that is happening to me.
Okay.
So it's not at the level where I feel like I need to go see someone, but it's like I'll be fine now, and then 2 minutes later, I'm honking at people in front of me. I'm like, hurry up, anxious, and it just goes up and down.
And those are the moments that you can use the breathing technique. You begin to breathe in and out slowly and profoundly, and you will find yourself relaxing to the point where you're not as enraged or as irritable with the people around you. So definitely the breathing technique is always, something that everybody should learn. Children, adolescents and adults. Once you know this, and you know that you can use it anytime, anywhere, you're good.
You mentioned that you had to use hypnotherapy when you were walking to finish that
Yes.
marathon. And I'm sure that can be a long process, but just for this audience, what could be an introduction to that hypnotherapy that we all can perhaps take that on and think that we can do something like this?
Well, in hypnosis, the first thing we do learn is how to use the breathing exercises, okay? And then after you learn how to breathe, some people don't even breathe right. You have to remember that you kind of, inhale as in a balloon and then exhale. And so part of it is learning the breathing exercises and then going into a state where we learn how to go into like a trance state, and everybody does this. When you're watching a movie, when you're doing something that you're interested in, and you just kind of sit there, just looking. And so that's the next step in terms of helping yourself calm down, get into a trance state where you can go into a particular place in your mind where you kind of become oblivious to everything around you. It could also be like a meditative state. And you go into some place in your mind, and people have used this technique successfully, even for individuals who have gone into surgery without anesthesia. They go into a place in their mind, whether it's on a beach, where they're, looking at the waves, and they're noticing all the colors, and when you feel things, so you use all your senses in this trance state to then reduce any other symptoms that you're looking to. But it's important also when you go into hypnotherapy, it's also looking at what it is that you want to change in your behavior. Is it the feeling of rage against other people? Is it the feeling of, of the night sweats or the actual experience of night sweats? That kind of thing. So a hypnotherapist can walk you through this so that you can learn to do it at home at any time, usually at nighttime or in the morning, and you can relieve many of the symptoms that you experience.
One more question, and then we're going to be wrapping it up. And actually, I have a question, if no one has another question. Okay, so go ahead.
Anxiety. Sometimes, you think of anxiety when you're stressed about something. I get that feeling, anxiety, that my heart races. And if it's in the evening, I'm just relaxing, watching TV, and I get that anxiety. What would trigger something like that? Because I'm not feeling anxious at that point. What would
Sometimes there are things at the unconscious level, and this is where hypnosis also comes in, because we work with the unconscious level. And for years, we've just been hearing things, seeing things that affect us, and that in a given moment, you can just begin to experience something that, even with the tearfulness, women are saying, but, why am I crying? I'm actually not unhappy at all, not sad. And so there are other issues that trigger, in those moments, the anxiety or the depressive state or the cheerfulness.
Now, I have a personal question, because I'd love to consider hypnosis, but I have a type A personality, a very controlling personality, where I think I would have a hard time giving away control of myself and my mind to a hypnotherapist. How do I approach something like that?
Well, in hypnosis, what happens, and I've heard some horror stories, and a lot of people have seen the stage hypnosis where they see someone, a hypnotist, come in and hypnotize somebody, and they act like a chicken or a pig or whatever, and they take off their clothes. And this doesn't happen. I mean, those are shows that are put on, to give that type of effect. But one has to explore individuals who are hypnotherapists. There are MDs, there are social workers, there are psychologists, there are all kinds of people and lay people who learn hypnosis. Usually, people do not go into a trance state so deep that they don't get out of it. So part of it is also giving up that fear that you may feel about someone else having control over you. For example, I've been in the mental health field for so long that when I was in training as a hypnotist, even the best of the best could not hypnotize me, because we have to go to these trainings with all these individuals who have been there for years, for 30 years maybe. And it was very difficult for them to hypnotize me because I just wouldn't allow it. And then one day, in one of my trainings, I said, well, Doris, you really got to do this because you want to be a hypnotist. You want to be a hypnotherapist, so you've got to let them hypnotize you. And then I let go of those defenses. And I said, okay, I'll do it. And I let it go. I let go the fear, I let go the anxiety of not being in control. Although you're always in control, really, because you're aware of your environment and what the person is saying. And let go, and I was even regressed to a time way, because you can get regressions of past lives, and you can regress to a time when there was a trauma in your life, and you need to overcome that trauma. So for me, it was a beautiful experience, and that's when I learned that I could, as a hypnotist, offer that for many people who have been suffering for a long time. So you got to let go those defenses. That's it.
One last question. Go ahead.
Could you talk a little bit more about the antidepressant drugs?
Well, I don't go into the drugs per se. It would have to be a psychiatrist who would say which are the best drugs based on, your physical state and mental state, et cetera. So there are some good drugs out there. I'm usually the type of person who I'm not really for drug therapy, prescription drug therapy, but I've seen in my clients, I've seen how they deal with their anxiety. I see how they deal with their depression using prescription drugs. And so, it's up to a psychiatrist to determine what kind of drugs are best for what you're experiencing. And if it's based on something else that, has exacerbated your symptoms of menopause.
Thank you so much,
Well,
Doris.
thank you.
What a pleasure. Thank you very much.